Hello, this is Dr. Shumon Mollik, radiation oncologist from Narayana Super Specialty Hospital. So today is the Cancer Survivor Day, and cancer survivors are the main pillars of any war against cancer. So they are the main educator for any of us. They are our inspiration and they are our strength for our future endeavor. So best wishes to all of our cancer survivors. Thank you.
Hello everyone, I am Dr. Vivek Agarwala, Director Medical Oncology and Hemato-Oncology at Narayana Super Specialty Hospital, Howrah and R.N. Tagore Hospital, Kolkata. Today, on the occasion of Cancer Survivor Day, I wish all my patients who have survived this deadly disease a very happy and successful life ahead. They are living examples of how a disease as dreadful and as horrific as cancer can be defeated, and we can come out successful after treating this disease without any major problems and without any lifelong problems that may be expected. So cancer, although it is a difficult disease, a difficult name that we all are very afraid of. But remember, if detected early, cancer can be treated and it can be cured. And to defeat cancer, to cure cancer, whenever you have any slightest of suspicion of any such problem, contact your nearest oncologist, develop healthy lifestyle. Try to undergo whatever the cancer screening programs are available, like cervical cancer screening, like oral cancer screening, like colorectal cancer screening, breast cancer screening, so that we can detect all these cancers at the earliest stage when we can cure them. And even if you have advanced cancer, remember, even in the advanced setting, we have wonderful systemic therapies that can prolong the life to a very significant amount. We can improve quality of life and we can improve patient survival. And even if you have advanced cancer, there is good treatment available, so you don't have to worry. It is just nowadays like chronic disorders that advanced cancers are also there. So do not fear cancer and empower all of us to treat cancer and defeat cancer. Thank you.
I'm Dr. M.V. Chandrakant. I'm a medical oncologist and hemato-oncologist in Narayana Health, Kolkata. Well, in the present day, we are able to cure 2 out of 3 cancer patients. We have so many cancer patients living with us and we don't even know that they have cancer. So the treatment of cancer is now becoming just oral tablets, and there are so many of them who are cured of cancer. I have my own friend who's a doctor who's a cancer survivor. I have a schoolmate who's a football player and is representing the nation. So cancer is no longer a barrier for any of the survivors, and they can lead the life just like any normal human being. And cancer remains a history, it remains past, and it doesn't bother you provided you survive it. So together we will fight so that we all become cancer survivors. Thank you.
Hello, I am Dr. Neha Chaudhary. I am a consultant breast surgeon at Narayana Super Specialty Hospital, Howrah. Today we are talking on the World Cancer Survivor Day, and cancer survivors are very important people for us. As the treatment of cancer is becoming better and better, as we are progressing with science, we have more and more patients who are surviving cancer. So there's an entire group of people who have lived through cancer, who have survived cancer, and who have got back to their normal lives to live their normal lives again. But we need to understand that this group of survivors, they face a lot of issues on a daily basis. There are issues of self-confidence, there's issue of fear of recurrence, there are issues of deformity, the disability which has been caused by cancer treatment, and there is a lot of other social stigmas which they face. Together, if we discuss these problems, we can fight these issues and we can solve it for them. While one important message to all the cancer survivors would be, let cancer be a page in the book of your life and not the entire book. Live through it, move ahead and go on and live your normal lives.
Hi, this is Dr. Kaustav Basu, consultant gynec oncologist and robotic surgeon with Narayana Super Speciality Hospital, Howrah. Today is World Cancer Survivor Day, a very special day. This is a day for our cancer survivors, our patients. So, our patients who have survived the deadly disease called cancer, when they turn up to us, we feel very proud, we feel very privileged because they are the inspiration for us. Because of them, we are trying our best. We try to study whatever type of therapy or means so that they can survive. We can prolong their survival. So I wish them all the best for their future. And you must be aware that 3-4 decades back, when cancer treatment was not very advanced, the number of survivors were very less. But with the advent of newer technology, robotic surgery, different forms of chemotherapy, immunotherapy, radiation therapy, we have many patients who are increasing the category of survivors. So we have a lot of survivors now who crowd our OPD clinic, and we feel very proud when they come. Thank you, the survivors. I wish all the best to all of you. Thank you so much.
Hello, I am Dr. Tarun Jindal, Head of Uro-Oncology and Robotic Surgery at Narayana Super Speciality Hospital, Andul Road, Howrah. We are celebrating the World Cancer Survivor Day. The cancer treatment is a very prolonged treatment. It is a multi-staged, multi-pronged treatment. And the patients who come victorious out of this treatment have a very good story to tell. The message for this particular day would be that the cancer is not something to be afraid of. We can win over cancer provided we are diagnosing the disease early and we are providing the treatment as per the requirement. So please don't be afraid of cancer. Your story over the victory of cancer will be a memorable one. Thank you so much.
I am Dr. Sisir Kumar Patro, hematologist, hemato-oncologist and bone marrow transplant physician in Narayana Super Speciality Hospital, Howrah, near Nabanna. 5th June is a World Cancer Survivor Day. Nowadays, cancer is not a disease which we are not able to treat. It is very much possible to treat the cancer. I am treating mainly the hematological cancer, like blood cancers, lymphoma, leukemias, all these things. Nowadays, in hematological cancer, there is a survival after treatment. Survival chances is very good. If patient come to us early of the diagnosis, then we can treat the patient adequately and we can cure the patient. Maximum of the hematological cancer patient we can cure the disease. And if some patient even not responding to the initial chemotherapy, we can cure this patient by the bone marrow transplantation. In Narayana Super Speciality Hospital, Howrah, we are doing all sorts of bone marrow transplantation like autologous bone marrow transplantation, allogenic bone marrow transplantation and haploidentical stem cell transplantation. Thank you.
Hello, I am Dr. Shreya Bhattacharya, a consultant head and neck and microvascular surgeon, currently with Narayana Super Speciality Hospital, Nabanna, Howrah. First Sunday of June is celebrated worldwide as Cancer Survivor Day. This marks the poignant yet inspiring stories of survivors of this deadly disease. There is nothing fair about cancer, and it's an unfortunate occurrence. Although with the recent technologies, the life expectancy and chances of survival have improved, the number of cancer cases have not reduced. Here at Narayana, we salute the fighting spirits of the survivor of this deadly disease and their ever supportive families. Come on, here on this day, let's pledge to fight off this evil with sheer grit, determination, positivity, and a little bit of belief in the higher powers. Thank you.
Hello, I am Dr. Dipanjan Majumdar, consultant radiation oncologist, Narayana Super Speciality Hospital, Andul, Howrah. Today I am going to share my thoughts on the occasion of the Cancer Survivor Day. Cancer Survivor Day is the way for the cancer survivors to share their journey and offer hope and inspiration to those patients who have been newly diagnosed with the cancers. Cancer treatments are often multifaceted. At different stages of the cancer, patients usually receive chemotherapy, radiation therapy and surgery, and those treatments are sometimes have got some huge side effects. For the patients, doctors are always there. Patients come to the hospitals for the improvement in the quality of life and doctors help them. But it is not always the doctors, because the cancer survivors are those who know the journey well enough and hope that the National Cancer Survivor Day will help the cancer survivors and their families to come together to share their thoughts and to help each other and also extend their support to those patients who have been newly diagnosed with the cancers and who have been undergone the cancer treatment. Thank you.